It's your third trimester. You're in the end zone of pregnancy. Let's spike that ball and make a touchdown. The third trimester of pregnancy is such an exciting and scary time of pregnancy. I know you might think, oh, I'm missing so many things. I want to make sure that I'm getting prepared. So today I'm going to give you a third trimester checklist. And in fact, you don't have to remember everything. I actually have a third trimester checklist plus a whole prep pack, including a postpartum plan that you guys can get down below. I'll put the link in the description. Now, you've been pregnant for a while, and hopefully during that time, you've realized that you need to learn from an expert. In case we haven't met yet, hello, I'm Hilary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I'm your bump to bassinet bestie who is here to get that baby in the bassinet and help you have a positive hospital birth experience. And in fact, your belly is hopefully not the only thing that's growing. We are actually really trying to grow our YouTube channel around here. And when you like this video, it really tells YouTube this is high quality pregnancy content. And please subscribe so we can hang out for the rest of your pregnancy. Okay, third trimester. What should you be doing? Now, I want to be really clear. This list is not exhaustive. We're not going to talk too much about baby preparation. If you guys are interested in a baby preparation video, tell me down below and I will give you my basics for baby. But today we're mostly talking about preparing things for you. The first one is to keep moving. And I get it. In your third trimester, it is real easy to feel like I am going to lay on my bed in the fetal position and come out when baby's ready to be born because you are just so tired, especially where you have time to relax. You do not want to be working out, but I'm here to tell you that if you do some simple body movement, I'm not talking about running a marathon, it is really going to pay off. Big fan of prenatal yoga, big fan of moving our body in lots of different ways. So you're looking for a workout that is going to give you full range of motion in your body. A lot of us get walking a lot, which is just one plane of movement, but the more you can move your hips laterally and really stretch out those ligaments, the better it's going to be for you. I am a huge fan of squats and lunges during the third trimester of pregnancy. I've watched so many physical therapists say that it really helps your pelvic floor get ready for what baby's going to do. I cannot recommend them anymore, even though I know they are so annoying. I am with you. I stand by you on that one. And really quick, if you have a prenatal workout person that you love here on YouTube, tell us down in the comments. I think it'd be really helpful if other people could share what they're doing to stay active during their pregnancy. Okay, in your third trimester, I swear I saw my OBGYN more than I saw my husband. I felt like appointments were every day, but I'm here to tell you it's super important. There's a reason that they're more frequently during your third trimester because we really need to make sure that you and baby are both doing well as we head into delivery day. So I would recommend making as many prenatal appointments as they will let you at your next visit. If you can make up until your due date, I think that is a smart move. That way you know when they're coming up, you can get childcare or whatever you need to do to arrange going to appointments. I think it's just a good idea. A lot of good OBGYN practices, in fact, will have you set up appointments in the future, especially the near-term future as you're seeing them so frequently in advance. And one thing I notice a lot of times is your provider might order an NST weekly or BPP, and then they'll order it on separate days than your appointment. Now, sometimes they do that because they want you to be seen on separate days, but sometimes they do that just because they're not thinking. And if your BPP and your appointment are close by, try and combine those. Ask your provider if that's okay, or if they're thinking they would like you to be seen multiple times, just like an appointment and then a BPP. It really depends on what's going on with you, but sometimes providers just don't even think, oh, it might be better if we had these appointments smushed together a little bit more. Why they don't think of that, I don't know, but I'm here to tell you it can be possible. Some of you might be thinking, I am not going to make it to all those appointments, but I'm still here to tell you, try and attend every single one that you possibly can. Really make them a priority. It really is so important. And if you can't make them, ask your provider if you can do a telehealth visit. I would recommend having a blood pressure cuff at home, things like that, but see what you can do to make them work for you. I know a lot of providers are trying telehealth right now. Okay, one of the things that's really easy to ignore in your third trimester is how you are fueling your body. Now, if you have gestational diabetes, you're probably really paying attention to what you're eating, but I'm here to tell you the news that the gestational diabetes diet is actually the way most pregnant people feel best to be eating. And ultimately, it is balancing carbs and proteins at every meal. So you're just trying to get in some protein at every meal and a few carbs, not an insane amount of carbs. Now, Did this sometimes look like a chicken breast and a brownie for me? Yes. Was that my smartest move? No. But making sure that you're balancing your carbohydrates with some proteins is really going to help you feel great during your pregnancy. So often I see people waking up, getting just some toast or a ton of sugar in their system and not balancing it with some protein. Think of yogurt, milk, cheese, nuts. The mornings can be really helpful. So just making sure that you're balancing those carbs and proteins is awesome. I think breakfast is the time that a lot of people just aren't great at that. And so that's a time to really focus on so that you can feel better throughout the day. If you just eat carbs, that blood sugar likes to take a nice roller coaster later in the day. And then the rest of your day, your body's just trying to compensate from that. So start your day with the carbs and the proteins. And in fact, in the online prenatal class for couples, I have a whole nutrition section taught by a dietitian because I am not one. I think diet is the ugly stepsister of pregnancy that we don't talk about enough. So pay attention to what you're eating. You need to get your mind prepared for this upcoming birth. So many of you think watching a few social media videos is totally going to prepare you. I cannot tell you how many times I've talked to friends who are like, oh, I've been following some people on TikTok. I don't think I need a birth class. And I am here to give you 3 truths about preparing your mind for your upcoming birth. Number 1, it is so easy to cherry pick what you are watching on social media, because you don't think you're going to have a C-section. You don't think you're going to have an induction. And so you ignore that. In fact, the algorithm is going to ignore that for you, because if we're not watching videos about C-sections, it will not show you videos about C-sections, even though it's really important that every pregnant person have a little bit of information about C-sections going in. Number 2, you are wasting a ton of time doing this, because my videos here on YouTube, in fact, I just went to go film one today and I thought, haven't I given a lot of this information before? I had, but it was a new angle and I had some different information. So I felt like I did need a separate video. But again, it was a repeat of a lot of what I've already said in another video. And you'll find that half of my videos, I swear, are about kick counts. So if you're watching me, you'll see a lot of information about kick counts, which I'm a huge fan of. But again, it's not preparing you all the way for birth because you're watching repeats of the same information. And finally, your partner is not watching the TikToks about pregnancy. I can guarantee that his algorithm might show one every once in a while, but it is not the same. He's not getting prepared along with you for birth. And you want somebody that is in this game with you. You do not need just a cheerleader. You want a teammate through pregnancy, birth, and when the baby gets here. You want them to be understanding what's going on. So come join me in the online prenatal class for couples. It, in fact, is made for couples. It is created to get you prepared for hospital birth in just about 3 hours time. And if you want to bundle it like an all-in-one birth course, you can also include breastfeeding, as I said, nutrition information, baby care, baby sleep. There's tons of information on there, and you get to decide what's most important to you and what fits your budget. I am so glad that we have online resources to prepare you for birth, but suddenly, because it got easier to get prepared versus coming on Tuesday nights and sitting in our hard chairs at the hospital after trying to find parking for a half an hour, somehow less people are taking birth classes, and overall our birth trauma is increasing because of it. Okay, if you're in your 3rd trimester, I've also noticed some mistakes that people make. You'll want to make sure that you're watching this video about that. But tell us down in the comments, how else are you getting prepared for your 3rd trimester? I think it would be fun to have a conversation down there. And maybe I need to make another video about this with some more tips for my 3rd trimester moms, because I know you guys are getting prepared for birth and I'm so glad that you're here.